Hi, my name is Rachel and I'll be discussing how seclusion is applied to manage mental health illnesses. For this intervention to be applied, the nurse will gather equipment that is needed. This can include the organisation of the seclusion room, equipment for a strain, and the prescribed psychotropic drugs. The patient who is experiencing mental health issues which cause violent or aggressive behaviour are restrained. The patient is restrained with adequate assistance without causing harm to the patient. All personal possessions are removed from the patient, including items from their pocket, their belt, shoes, necklace, and any other items that may cause harm to the patient and the attending staff. The patient can be then assisted to put on safety clothing if necessary. In emergency situations, the senior registered nurse can authorise the seclusion of the patient. However, the treating physician must be contacted in the earliest possible time. The physician will then order appropriate psychotropic medication for the patient. This will reduce aggression of the patient and help to assist. When the patient is settled into the seclusion room, observations are frequently made to assess the condition of the patient. The patient is assisted in feeding, toileting, or bathing by 2 staff members to ensure the safety of the patient and others. All food and fluid are given in non-breakable containers. How it manages mental illness. Nurses implement many interventions and techniques to a patient who is distressed, irritable, aggressive and violent, who may pose danger to themselves or others. Various interventions are used well before seclusion. Seclusion is commenced when all other interventions have failed. Ideally, seclusion can be seen as a last resort. Seclusion of the patient at the time of crisis manages the illness by preventing harm to the patient or others. Seclusion is used in emergency situations where the patient has lost control, is destructive, and not responding to verbal command and is overstimulated by the environment. The nurse has many roles when the intervention of seclusion is applied. This includes knowing the side effects and contraindication of all prescribed drugs, knowing why they are used, and also to be able to administer them. The nurse must frequently assess the condition of the patient and each check must be documented. The patient is to be monitored every 10 to 15 minutes. Nursing care involves concern for the patient's dignity. Debrief with the patient after time of crisis to reduce harm towards patient and others. Seclusion is a nursing intervention that is used in order to assist those suffering from mental health illnesses. There are many factors that influence one to apply this intervention. Common factors include demographic characteristics such as age, sex, and race, their care provider, their environment, their organisation, and the norms of the treating team. It is evident that there are positive and negative aspects of applying seclusion to those who are mentally unwell. However, it is important to analyse whether or not the positive outweighs the negative aspects. Nurses have many roles when the intervention of seclusion is undertaken. It is crucial that all necessary documentation is recorded. Nurses implement many interventions and techniques well before seclusion is used. It is legal for an individual with a mental health illness to be placed into seclusion at an approved mental health service. Thank you for watching.